Make sure to like and subscribe and hit the notification bell to receive helpful tips on how to relieve pain. If you have any questions, put it in the comment section down below. Hey Charles, tell me what's going on with your right knee.
We just had the operation and the injections, and I have a little bit of pain, but the most difficulty I have is probably when if I'm sitting down for a long time, like driving, sitting at a table eating, when I get ready to get up, it seems kind of weak, so it seems like it wants to
give out or
whatever. But once I start walking,
it starts to loosen up.
Yeah, it starts loosening up. I'm pretty good after that.
So you said you had a surgery. What type of surgery you had and injection you had?
I think it was the orthoscopic.
Orthoscopic for your knee. Okay.
And they repaired a torn
meniscus. Okay. And what type of injection you had? Gel?
He's been putting some gel in it.
Yep, viscous. Okay. So when did you have the surgery?
About 2 months ago.
2 months ago?
Yeah. I think it was at the end of September.
Okay. And tell me about your current symptoms. How much pain do you feel there and what type of pain?
Right now it's probably, it's only about a 5. It all depends which way. Like I said, if I sit for a while, it's, you know, and then I get ready to get up, that's when I get the pain.
And where do you feel the pain when you feel the pain?
It's usually at my knee, around this area.
So as soon as you get up, you start to feel the pain.
You know, get about 10 or 12 steps and it starts to dissipate.
To loosen up? Okay. What else is difficult for you to do? Stairs?
No, stairs usually aren't, but you know, maybe in the morning coming down.
Yeah,
you know,
when you wake up in the morning.
Usually, like grab onto something. But
sure.
I can come down without holding on anything, or I can go the same way.
Sure. So let me see how you walk first, and then I will take your range of motion. Okay. So we're gonna walk here, just a straight line back and forth, just normal walking, and turn around. Okay. So your leg going a little bit out. Okay. Just okay. So I want you to lie on your back, the same table. We will measure your knee range of motion before we do the treatment. Then we'll do the treatment and we'll measure it again. Push your knee down. So as you see here, his knee extension is minus 15. Right in here, minus 15. Okay, bend your knee. Okay.
That's where I start to.
That's where you start to feel the pain.
Yeah.
And the knee flexion, it's 100 here. You see the number 100. Deep, or you feel that it's outside? Relax.
I would say kind of deep, not more so on the outside.
The joint itself?
No, it's mainly right around in here.
Oh, both sides like this?
More on this side.
Yeah, yeah. Did you scratch yourself here?
Yeah, I hit myself on the side of something.
Be nice to yourself, okay? Yeah. Yeah. Is that painful? It's okay.
No. Okay.
So I'm just trying to release the tightness, and then we're gonna measure your range of motion afterward and see how are you doing with that. Okay.
Okay, what in Irvine?
That's painful. Okay.
Okay, let me go ahead and transfer you. Okay.
All right. So let me know if you feel pain with that, okay?
Okay.
Is it painful? It's okay.
No, I don't feel no pain.
Okay.
All I feel is the pressure. That's all.
That's good. Just pressure. Okay. That's good there now. Can you tell the difference here?
No, just like I said, just pressure. That's all. No
Okay.
pain, nothing.
I'm sorry?
All right.
Yes, it is.
Okay, let's bend your knees. Okay. Straight your knee. Straight, straight, straight. Okay. Let me know if you feel pain, okay?
Okay.
Okay.
Any pain with that?
Give me 1 second.
Yeah, on the outside, saying, well, on the out,
Okay.
on the outside underneath.
What about now? Do you feel pain? Yes? No?
No,
Both? Okay.
it's very low.
Mhm.
It is.
Okay. Alright, relax. Let's bend your knee and tell me how this feels. How's that?
Oh, a lot better.
A lot better?
There's a, like it took out the stiffness.
Okay.
The pain.
Let me check the range of motion now. Okay, so it's about 110. Let's try to work on it more, see if we can. Can you roll this up?
Yeah, I'm gonna try.
It's a little bit tight.
Sorry, next time I will.
Nah, that's okay.
Realize it.
Yeah. Oops. There you go. Okay, it's gonna feel cold, okay?
Yeah.
So I'm working on breaking the scar tissue.
Oh,
Okay. So you feel those bumps here?
Yeah.
This
I
is
do.
scar tissue. So
Oh, wow.
yeah, our muscle should act like a rubber band. When it contracts and relaxes, it does this.
Uh-huh.
When we have a scar tissue, it's like you have a knot in the rubber band. So when your muscle contracts, it does not stretch
Oh,
much.
wow.
And that's limited the range of motion. And if you have too much scar tissue, it could compress on artery, nerve, or cause like numbness or tingling. So what I'm trying to do with this instrument, with ASTR instrument, is to break in those scar tissue to loosen up. And you can feel it here. You feel like it's
Yeah.
a washboard, yeah. So and that's pull on your knee and limit your range of motion. So I'm gonna break that down, and then we're gonna measure the range of motion afterward and see how you doing.
Okay, I think she just called me. I had transferred her to the Irvine office.
Yeah, I had no idea that was happening.
Mm-hmm. Yeah, scar tissue happen with any injury, like accident, trauma, or poor posture, poor body mechanics, or surgery. It's a normal part of healing process. But if we have too much scar tissue, that's cause limitations. So the goal is actually to break that down. So you will gain the range of motion, and hopefully that relieve your pain. You feel that, and you will notice over time that the scar tissue will start to shrink.
No.
Okay.
Still get the pain.
How much pain?
Probably about 4.
For now, it's 115. Okay.
That was more.
Yeah, 115. It was 100 first. Where do you feel the pain?
Right in here. Like,
Right in there.
Yeah.
Okay. All right. Relax.
Okay.
Relax. Is that painful what I'm doing here?
just a little bit. Just right underneath here.
Right underneath. What about when they do this? Is that painful? It's okay.
Okay, so
Yeah, it's painful.
Sorry.
No, no,
What
no.
about
It's, I
when
mean,
they do here?
I can stand.
I don't believe in painful treatment because there's fine line between releasing and causing damage. If you start feeling pain, that's mean there's a chance we're causing more trauma to the healthy tissue, and that would cause more scar tissue. So it will interfere with the progression of the treatment. So I don't want to have. I don't want you to feel pain. You know.
No, the driver.
Okay, that's bent. Do you feel pain or it's gone?
No, I still feel pain in the same
How much?
places. It's
Where?
still right now about 4.
Where do you feel it?
Again, it's right in here.
Right in there. Okay,
Yeah.
relax. Okay. So let's relax. Then, okay.
It seems like when I have it like this and I'm relaxed, it like releases the pain or stiffness, you know.
Yeah, because there's a
That's what I'm
pressure
trying
on
to
it and tightness.
¿Quieres el cita, verdad? ¿Quieres el cita? Ok, permítame un segundito, ¿ok?
This painful here?
No.
Okay, now feel easy, okay?
Yeah. just pressure. Where you're
Pressure.
pushing.
Okay, pressure is fine.
Yeah.
As long as you don't feel pain, that's okay. Okay, let's bend again.
I'm gonna send her out.
And tell me how this feels.
It still feels a little stiff, stiffness, you know.
Okay.
It's almost like, you know, sometimes you need to stretch
Yep.
to make you feel better.
What about the pain?
The pain's still, it's about 4,
Okay.
maybe 3. You know.
So now,
a little bit less though.
yeah, it's a 118, so that's 18
Oh,
degrees.
you're kidding me.
Okay, so let's actually, and you feel it right on that spot, yeah?
Yeah.
Right in here.
Yeah. Yeah.
Yeah, relax, relax, relax. Relax.
Right.
Mm-hmm. Is that painful what I'm doing? Or is it okay?
No.
Okay, make sure this is not painful. You're really tight. We got a lot
Yeah.
of work to do. Let's lie on your side. So you have a lot of scar tissue in your hamstring in the back here. Is that painful here? You feel that?
No, it's not painful, but I can feel the ripples you're
Yep,
talking
yep,
about.
yep. That's a
lot
scar
of ripples.
tissue. A lot of it. And here, you feel that?
Yeah. Like a horse sport.
Yeah, yeah. Yeah, you will notice this is will decrease with using ASTR instruments. And you hear that?
Yeah.
You hear that? I don't know if you can hear it in the
Yeah, I
camera.
can.
But it's a loud sound that, and here there's hardly no sound.
Right.
And
You know ripples.
yep, you
There.
yeah. The good thing about this instrument is very well designed to really help to detect the scar tissue and to break it down. And okay, is that too much?
No, you're doing
Okay.
I mean, there's a little bit of pain when you're rubbing
No,
over,
no,
but
make sure it's
that's
not painful, okay?
It's not nothing that I can't stand.
No, make sure it's not painful.
Okay.
There's fine line between breaking the scar tissue and causing scar tissue. If you feel pain,
okay.
we actually causing more scar tissue. We don't want that. So this is
Just a
start to
little bit.
loosen up. Okay. Let's see. So it's about the same. It's about 120. You see that? 118, 120. Okay. Right. Let's walk back and forth. Let's walk. And tell me how you feel with walking now after working on it. How's that?
Feels pretty good.
Can you tell a difference after working on it?
Yeah.
What's the difference?
It doesn't hurt so much this way.
Uh-huh.
You know.
Yeah.
So it seems like it's kind of
We just worked on a few seconds on your back. So tell me what happened to your knee after working a few seconds. I know before we started how much pain was there.
I was at around 4.
4,
She worked
yeah.
on my back, and it almost went down to 0.
Yeah, awesome. Yeah, thank you. So
Totally relaxed.
that's good. So let's show us how you move your knee now. Okay, don't break the table. How is that?
That's really good.
Yeah, I'm glad you're doing better.
Big difference.
That's good.
I'm surprised.
Surprise? Okay, awesome. I'm glad you're doing better. You can treat your pain at home and get similar results as what you just seen in this video. Simply click the link on the screen to start our home treatment program and begin your journey of healing, or go to asterinstitute.com.